So my poster is about mucinous tubular and spindle cell carcinoma, or for short MTSCC. MTSCC is an incredibly rare subtype of renal cell carcinoma that comprises just under 1% of all cases. In the cases that do exist in literature, it's generally known to be an indolent, slow-growing carcinoma that has a favorable prognosis. This case differs because it's the case of a 67-year-old woman who had aggressive metastatic mucinous tubular and spindle cell carcinoma. She underwent a left radical nephrectomy, which pathology showed to be MTSCC with a sarcomatoid component of 50%. She was then in remission until about 2017, when imaging showed a growth in the left renal fossa and omental nodules, which are shown in Figure A. She then underwent percutaneous cryoablation therapy for these growths. When new peritoneal nodules were found in 2018, she was placed in her first line of systemic therapy, which was sunitinib, and when her disease further progressed in 2021, she was switched to nivolumab. Fortunately, she had to be taken off of nivolumab relatively quickly due to immune-related colitis. She was taken off of medication and placed on surveillance for 2 years. In 2023, when imaging showed a new mediastinal lymph node, the patient was placed on her third line of therapy, which was cabozantinib, and initially her disease responded quite well, which is shown in Figure 2B. Fortunately, a couple months later, the size and extent of the lymph nodes had increased, so she was placed on tivozanib as her final line of therapy. Ultimately, her clinical course came to an end when substantial disease progression prompted the patient to pursue hospice 3 months later. I think this case is important because it highlights how MTSCC is a unique variant of renal cell carcinoma that has specific chromosomal losses that differentiate it from other subtypes, such as papillary RCC. It also shows how treatment guidelines specific to MTSCC are still generally lacking. I also think this case is unique because it illustrates how, though MTSCC is usually an indolent entity, this case illustrates how it can manifest as exceedingly aggressive and refractory towards multiple lines of therapy. This case also shows how histopathological characterization is key to identify those high-risk features such as sarcomatoid differentiation, so you can better inform the treatment decision-making process for your patients.